Hello, Dr. Maria here again. So, I want to talk today about diabetes and it's specifically type 2 diabetes. November is Diabetes Awareness Month, and I do not want this month to go without me talking to you a little bit about it. So, if you have been following me on social media or perhaps gone to my website, you probably know that I was a person growing up with diabetes, and it's specifically type 2 diabetes. A lot of people, when I say that, they think that it was type 1, right? Because we think of type 1 usually as a young onset and not being able to produce insulin in your body. But I was a person living and growing with type 2 diabetes. And in my journey, I learned that there are things that you can really do that will help your body heal from the inside out. Now, that doesn't mean that you might not be predisposed, right, in the future to develop diabetes. You still are. But if you develop a consistent way of taking care of yourself, you will be able to live without having to have the label or have to take the multiple medications that sometimes people with diabetes type 2 are on. So, people that have type 2 diabetes spend a lot of money on their care, right? Even if they have insurance. And I have a couple of blogs. Yes, that's my little cat. I have a couple of blogs on my website that actually tell the numbers. But it costs them money and it also costs them time, up to 4 hours a day. Think about that. That's half of your work day for people that have type 2 diabetes on self-care. So what are some things that you can start to do? And these are the things that I recommend to my patients on top of doing other things so that they can come off of their medications, so that they can reduce their A1C, improve their cholesterol levels. Because a lot of people that have type 2 diabetes have never heard that you do not need to be on medications for life. It does mean that you have to take care of yourself differently. So the first thing that you can do is increase your consumption of fiber. Yes, fiber is your best friend when it comes to way of eating. And I tell my patients very simply, right? A lot of people are like, well, why don't I do like keto diet? Well, a lot of the times in a traditional keto diet, what you do is that you increase animal protein, which has absolutely fiber, no fiber at all. And it actually also increases saturated fat. And saturated fat is one of the things that does not allow the insulin that you are producing in your body to carry that sugar into the cells, which is where we want it. We do not want it in the blood. We want it inside the cells so that your cells can produce that energy. So, eating fiber, and you want to try to hit those 30 grams a day. The majority of the people in the United States eat only have 15. That's why there is so much constipation, but also that's one of the reasons why their colon cancer, right, incidence has been increasing, because fiber will help you. Fiber will start to help your metabolism change. You'll go to the bathroom, you'll poop. It will also help your gut microbiome. So it has a lot of health benefits. And we want to eat this fiber from fresh fruits, fresh vegetables. Yes, fruits, you heard me, but if we're talking about fresh fruits, and it's not 40 bananas a day that you're eating, so you can eat some fruits. We're also talking about beans, legumes, chickpeas, and then what we call wholesome grains, right? So it's not the same as eating the tortillas or the bread than eating wholesome oatmeal, quinoa. And a lot of the times when it comes to food, what I have learned over the years is that people have some resistance to change the way that they nourish their bodies. And what I invite you to think is, if you have that resistance, why is it? Mindset is very powerful. If you have a growth mindset, you won't be afraid to try new things, to eat things that maybe you have never eaten, right? Because you have a mindset that will help you reach your health goals. Versus when you have a fixed mindset, you would say, no, I'm going to do what I have always done and just prescribe me the pills. And there's nothing wrong with that if that's your choice, but I invite you to consider, do you have a growth mindset or do you have a fixed mindset? Because that will be important. The other thing that you can do, if times allow, is think about if you can walk or move at least 10 to 15 minutes after your meals, and especially your big meals. And I know that here in the United States, people tend to have their largest meal at nighttime. Guess what? That is what for when all people, right? So everybody has this, their bodies were designed like this. It is at nighttime that you can use less the insulin that you produce. So if you already have problems, right, or your body has difficulties using the insulin that your body already produces, at nighttime it becomes even more challenging. So really think about, can you eat more calories, breakfast and lunch together? Have a smaller meal. But if for some reason that day things happen, because life happens, right, and we do not want to live in diabetes jail, then think about, can you move? Can you walk? Right? Moving your muscles, we were designed to move them, will actually help your body regulate your blood sugar better. And you probably say, I have heard this, eat the right thing, move. Well, diabetes care is a little bit more complex, especially type 2 diabetes. A lot of the times we think that it's only about the sugar level, but what we know is that it's a lot more complex than that. It's a metabolic effect that is going on in our bodies. I usually tell people also, think about how you're sleeping and your levels of stress. If you are a person that lives with type 2 diabetes, your body already has, higher levels of blood sugar. And then when you do not sleep well and when you have high levels of stress, hormones like cortisol and adrenaline are also high in your body. What it tells them is it tells your liver, throw in more sugar into the, blood, because this person needs to run from a tiger. But guess what? You really do not need to run from a tiger. So now you have all of this added extra blood sugar because your body thinks that you have to run from a tiger. The reality is that you don't. And that will also keep your blood sugar elevated. That's one of the reasons why caffeine, yes, you heard me, the coffee and the teas and those energy drinks that maybe you're drinking because as a person living with diabetes, you might feel fatigue and with a foggy mind. Well, at the same time, that is also increasing those hormones and can lead to higher levels of blood sugar. So there are small changes that you can think about doing. When I think about alcohol, it's not only that alcohol are empty calories, and this is not a moral judgment. I have red wine from time to time because that's really my favorite one. But it's more about thinking, so when you consume alcohol, and especially at nighttime, not only is it empty calories, but alcohol will become sugar. You have it at nighttime. Your body has even more difficulties with the insulin, with the sugar at nighttime. So you see how these small things start to add up. But most importantly, the reason why you should be careful with alcohol is because a lot of people that have type 2 diabetes also start to accumulate fat in the liver, develop what we call fatty liver. So now you're throwing alcohol at this liver that already is in a vulnerable state. The other thing is that people that have type 2 diabetes is at increased risk of dying from heart conditions. And for somebody that has diabetes, even if your cholesterol is not high, what do they automatically do? They put you on a statin because they are trying to protect you from having problems with your heart. But guess what? If you're able to reduce your consumption of saturated fat, so again, that's the fat that becomes solid in your blood vessels and does not let the blood pass, guess what happens? That will not only prevent you and help you not develop those heart conditions, but then again, it will also help your body use better insulin and take that blood sugar into the cells for the energy that you need. So when I was diagnosed with type 2 diabetes as a child, I learned to nourish my body in a different way than what mom and dad taught me at home. I still love my Puerto Rican food, but I make adjustments so that I am not eating those simple carbohydrates that elevate your blood glucose, which is what we call the glycemic index. I also learned to move my body, exercise, run. I really protect my sleep and I go to bed at a certain time. So I have learned to do these things that throughout the year have been sustainable for me. And then, if you think about a pyramid for the treatment of diabetes, that's what we call lifestyle behaviors. Then there are certain supplements that can help. And when it comes to supplements, what I would say is these you should discuss with your doctor, because some of them can have interactions with some medications, right? But think about cinnamon, berberine, something that is out there like holy basil that will also help your mood. Chromium, which helps your muscles. So there are some supplements out there that you might be able to use, right? To also reduce your blood sugar. And then if that is not working, then go into medications. And remember, some of these things will even cost you less than some of those medications out there. And if you do need those medications, it's not that there's something wrong with you, that there's something wrong with your body. But what I do invite you is to think about, and I'm depending on these medications, which might not necessarily still prevent the hemodialysis or the high blood pressure or the skin infections that people with diabetes have. It might not prevent you from developing fatty liver. And are you taking those medications because you still have this fixed mindset? Or maybe it is because you never heard about this. Or maybe it is because you know that that's what you need to do, but you do not know how to do it. Maybe you are afraid of change. Maybe you are afraid of change and then what that means for your family. I get it. It can be scary. It can also be difficult when you're making changes that go against the culture. And it can also be a little bit challenging to introduce certain things to your family. But there is hope. And if you are interested a little bit more on diabetes type 2 transformation, I am going to put a link in the comments for you to subscribe, because early 2024, I am launching my diabetes type 2 transformation method, a group visits, right? So this is in groups and personal. So it's this combination where we will dive in not only on teaching, but also support, and you will get some personalized blood work and supplements. And all of this just to help you regain control of your health. Until next time, bye.